Good evening, everybody. Welcome to Ask Our Vet live remotely from my kitchen this evening. Our first live remote. It's very exciting. So I have everybody watching, and I have some live guests walking around. All my animals are looking at me, wondering what I'm doing right now. But I'm Dr. Kris. Welcome to the show. I want to start out this week by saying, just apologizing last week. I know some of you who were on the thread last week, we had some internet troubles, and literally my whole thread froze, so I couldn't answer any questions last week. So we did flea and tick prevention. I thought what we do this week is kind of start with some questions that came in, say hi to everybody, just review a little bit, and then take any questions you might have. So the set's going to be a little unfamiliar. Maybe the lighting is not nearly as good, but we should still have a great show. So thank you very much for joining me tonight. Hi, Stephanie. Hi, Dr. Ulrich. Yeah, a little feet to start the show, right? Dixie Chicken, I figured, hey, why not? Hi, Candace. Happy Thursday. Hey, Kathleen. Yeah, we'll come back. We'll talk about that. I'll come back to that question. I'm just going to sign in with everybody. Hi, Catherine. Thank you. Hey, Nikki. Hey, Marilyn. Thanks for checking in. New York. That's great. Hi, Marianne. How's Georgia doing? I hope well. You know, Candace, it's a very good point. I don't even know what kind of plant that is. My wife does. I put that in the set at the last minute, and I thought maybe it added a touch to it. Anyway, we're doing our best here from the kitchen. So you may hear my dogs walking around, and my cats may walk through the screen at any time. I think everyone heard the church bells going off if you were here at 6 o'clock, just letting us know it was 6 and time to do Ask Our Vet, right? Hey, Kirsten. Oh, really? Did Kirby come over? Well, tell Kirby I said hi. Hi, Kirby. Hey, Deborah. Thanks for checking in from Detroit. I hope where everybody is, the weather is better than it is around here. It's been a pretty dull and dingy day. Kind of a tough week, because we had such a kind of glimpse of spring last week here in Connecticut, and then we kind of went into this cold, dreary, snow flurry, and rainy kind of week. But looks like next week, spring, I guess it's officially spring this weekend, right? And next week's supposed to warm up, so I think we're well on our way. Birds are singing in the morning, daylight savings behind us, so I think we're good. All right, Marianne, but she's doing okay after surgery. She's feeling okay. She came through the surgery okay. You can email me too, Marianne. If you want, you can email me. Let me know what the biopsy was and everything. All right. Hello, Morgan from Florida. How's the weather in Florida, Morgan? Nice down there? Hey, Lori Kochfoot. How are you? Thank you I think you checked in last week, but I couldn't see. So thanks for checking in again. And I thank everybody for coming back this week again. Like I said, we were a little glitchy last week. So hopefully my home internet holds up, and we can kind of go through this. All right. Yeah, Marianne, we'll make that happen. Okay. We can talk on the phone. Send me any stuff that you think you want me to take a peek at, and we'll have a discussion. Okay. So anyway, guys, last week we did flea and tick prevention, right? And we talked about options. We talked about why we do it. We talked about how our weather patterns really, obviously globally and certainly in the United States are changing, where, even in the East Coast, we're having milder winters. So parasites are a problem year round, right? And so, and obviously there's higher incidence seasonally, but those kind of winter die-offs aren't really happening anymore, right? So it is important that we prevent these parasites from getting on our dogs and cats, right? All right. I'm going to read a few questions, okay, that came in that we couldn't see last week. So I thought we'd start with some of those, then we'll get to your questions, and we'll go from there. Hope everyone's doing really well. All right. The first question is from Susan, and she asked, is it a fact that fleas cannot survive in Denver elevation? This was really interesting to me, Susan, because I've been to Colorado several times, and a beautiful, beautiful state, and I've been lucky enough to ski out there, and I have some of my best friends in the world live out there, but I did not know the exact answer to this question, so I had to research it myself, but it's an interesting question, and so here's the answer. And I looked it up for fleas and ticks because once I, as my dogs are playing here in the background, sorry, if I was going to look up fleas, I decided, well, might as well check ticks too, right? So fleas, they say, can survive up to 5,000 feet. Now, Denver's right at that, okay? So Denver's at 5,000, 5,200, 5,300 in there. So it's right on the border. Could I say there's no fleas there? No, but it is definitely borderline. Ticks are much more hardy and can live up to double that elevation. So ticks up to like 10,000 feet. So ticks certainly are an issue. And remember, for our dogs, ticks are much more of a serious deal because they carry a lot of tick-borne disease, like we talked about last week for our dogs. So fleas up so it's right on the border, and then ticks. All right, 10,000 feet. So certainly we worry about those out in Colorado. All right, Beata, who was on last week, and I hope a lot of you guys are on from last week or on this week, and I'm answering these for you, and I hope you can see it. If you can't see it live, hopefully you'll go back and look. Beata asked, is there any conventional product less invasive than others? And so, as we went through them, and and I have this discussion with my clients about my patients all the time, right? Whether you have spot-ons, collars, orals, they're all, or the majority of them, are some form, the traditional ones we're talking about, some form of neurotoxin for the parasites, okay? They're all meant to hyper-stimulate the nervous system of the parasites and stun them and kill them or repel them, okay? And I think we all agree, in a perfect world, we would like to use no chemicals, right? If we didn't have to use chemicals at all, absolutely we wouldn't, okay? I don't know that I'd say that, is there any one less invasive than others? I think that, there are, most people are aware of the Seresto collar and the USA Today article on it recently, where they talked about how, where they broke down the numbers of how many animals have gotten sick from it, animals that have died as a result that they talked about the collar. And, there are incidents with many or all these, okay? And it's the reason why, I was talking about, I think it's really, really important, as over the years as I've talked to Dr. Bob and Susan, all right? And they've always said, their mantra is that they have always been fundamentally opposed to using dogs and cats as a delivery system for chemical flea and tick control. And that's why they started the Nature's Protection, okay? Because they wanted a natural alternative, okay? Now, again, and I've had many discussions with Bob and Susan about this, and we realize you cannot achieve the exact efficacy with a natural product that you can with a chemical product, okay? It's just you can't. What we strive to do at Earth Animal, and what we continue to do as we're developing and improving and continue to work on our products, is we want to get our natural products as efficacious as possible. And our goal ultimately is to have them as simplified and as efficacious and just work as well as we can and achieve and get as close as we can. Many of those chemical flea products can 90% over 90%. And it's very hard to get there naturally. But if you can get close to it, and that's why we use a system with Nature's Protection. We use internals. We use the internal powder, right? And we use that coupled with a spot on or a collar with some adjunct shampoos and sprays and powders and things like that, okay? So, oh yeah, thank you for putting up and the goal of using that as a system is to help the animal from the inside out, and also treat and repel these fleas and ticks on the outside with a collar and spot on. Okay, but they all the traditional flea and tick products out there, the non-natural ones, are chemical based and mostly neurotoxins. Okay, now are there many animals that I've been on those that don't have problems? Yes, but as we've seen with that article, and we know of others, there are side effects to any of them. And what I do say is the no-brainer across the board. If you have an animal that is an epileptic, okay, or you have a sick animal that has other issues, okay, or a geriatric animal, it's a no-brainer. You want to do, natural products, because we don't want, we don't want to carry, they may be more immunosuppressed and things like that, okay? So those are the no-brainer. And then our goal is to have people integrate the natural product, where either we can eliminate those others at some point, or at least reduce the amount that we're using. Okay, so that's really the goal of the natural products. All right, I hope that answered the question. All right, so Patricia had a question too. We got a lot of questions, obviously, on Seresto, because it was it was all over the news, right? So there may be some doubles here. But we'll go through Patricia's. So Patricia asks, I've read some disturbing comments regarding Seresto collars, which I understood were much preferable to spot-on treatments. I'd appreciate your view. I used one for 3 weeks last year following unsuccessful attempts to clear out fleas. I've used sprays, diatomaceous earth, regular washings, combing, no fleas since. Yeah, Patricia, it is, we always, and we do this as veterinarians, we do this as pet owners, we walk that line, right? We walk the line of having to protect ourselves and our pets, especially in very, endemic areas for ticks, okay? And really, we always say flea and tick control, right? But the bottom line is, it really is, it should probably be called tick and flea control at this point, because really the ticks primarily, if you get the ticks and you can prevent the ticks, the fleas come along because the ticks are hardier. That's what I always say. So it is, again, you walk that line. There are risks with those products, okay? Let's see who else is checking in. We'll get back to our questions. Hey, Oreo Pup. Yeah, how is Winnipeg? It's nice and sunny, huh? It snows, spring's coming, Oreo Pup. Whole lot of you too. All right, let's see. Yeah, Bonnie. Look, like I said, it's if the goal always would be, if you can do something naturally, why wouldn't you? I mean, absolutely, I completely agree. All right, Jen, you know what I'll do is I'll wrap up. I'm going to wrap up the flea and tick stuff, and we'll come back and we'll get to your question, okay? Okay, Nikki, so good question. So the question is always, and I get this a lot, and this is with any product, not just the natural. If your animals, all right, girls, calm down. Come here, Sophie. Okay, hi. If you have an animal that is going in so obviously the internal is the internal. We talk about collar or spot-ons. If they are swimming frequently, it's going to diminish. It's going to diminish because it wipes off the sebaceous layer that these products kind of stay on. So if they're swimming, you should do it more frequently. Yes, you should replace them more frequently, depending on, you can ask me, depending on how often they're swimming. But it is something that, if even if you have the collar on and they swim a lot, and instead of doing it every 2 to 3 months, you replace it monthly, certainly affordable, the earth animal collars, then I, you can certainly do that. All right, let's get to a couple more questions, and then we're getting some other, hey, good fish, thanks for checking in. Let's see, let's get to a couple more questions here on the fleas and ticks. So Brioni asks about, so would you not recommend permethrin repellent spray for people and animals? And, just as someone who's been extremely affected by a tick bite, had Lyme and Bartonella, it's important to me that myself and my pets to reduce the risk of tick bite. Okay, so yeah, I mean, listen, again, we walk that line. We have to be, permethrins are very strong. Okay, and yes, they do a good job in the sense of repelling ticks and fleas. The problem is that they do have a decent amount of side effects, all right? And that, the pyrethrins, the permethrins that have come down from the organophosphates, and they can have, they're very strong, and that's why they work. But at the same time, you have to obviously always use anything like that with caution, because you can have side effects, especially cats. So we have to be very, very careful. And I know, I understand what your point is, and your point being is that you've been severely affected by a tick bite, and we want to make sure that we're clear. And that's why depending on where you are, we have to make these choices, right? And like I said, I do think that you can also use the natural products as adjunct to maybe reduce the amount or reduce the frequency that you're using the traditionals. And I think that's another thing that we have to think about. Okay. All right. We've got, I've got several on here again from last week that were repeats, so we don't have to go through them all. Diane Hertz here asks, does earth animals flea collars prevent mites? Diane, to my knowledge, they've not been tested with mites, okay? And I believe what you're talking about, one of the things that and actually not all very few of the flea products prevent or treat mites. And I know, Diane, you're probably talking about either Demodex or sarcoptic mange, which is one of the things that we saw a large uptick in, sarcoptes especially, in the area where we live, because we have a lot of foxes run around, and they actually can carry it. They can run through the backyard and go through the bushes and things, and then your dogs or your cat, your dogs go outside, they go through the bushes, they can pick it up that way. So, but the earth animals collars are not tested with mites to my knowledge. And mites are also very difficult to kill. Other people asked about the swimming. We answered that. So Millie had a question. Is it better to use yeast-free if you have a pup prone to ear issues? And so, very good question. So, different types of yeast, okay? Millie, it's the yeast that dogs get in their ears, typically, okay? And the yeast that's on their skin that can also add in skin, to skin infections is called Malassezia. That's the species. And that, believe it or not, the reason why they get that is that's in the environment, can be on their skin in very low numbers. As all of us, we always have bacteria, other things that's on our skin, same with our animals. The reason why, I think a lot of people think sometimes that allergies cause infections. And they do, but indirectly, okay? Because allergies cause itching. Itching causes scratching and biting. Biting and scratching cause breaks in the skin. Then you get opportunistic organisms, bacteria and yeast. So different yeast doesn't necessarily, animals, some animals can be sensitive to yeast, okay? And that's true. But the yeast that grows in and on the dogs is different, okay? Diane asks, does the powder have a taste that might make an animal not eat the food? Well, from what I've seen as far as the internal powders, it's the palatability is, most animals will eat it. Now, will some? Now, will all? No, of course not. And all animals won't eat anything that, There's animals that even, might not like peanut butter. Okay, so you really have to, you have to try and see, and obviously most of them will eat it and eat it in their food. Some of them won't, and then we have to talk about a different solution. But some animals may not like the taste. Let's see. Yeah, Mardell asks about the product ingredients and causing seizures in the Nature's Protection. And so one of the reasons why, Mardell, that we would use this product is in seizure animals, because no, we don't have anything in it that's shown to lower that seizure threshold like a lot of the other traditional flea tick products. All right. Yeah. Someone had asked if we have any research studies on the Nature's Protection. You can find that on the website. If you go on the website and look, there is mapped out areas that talk about efficacy and that sort of thing. So you can check that out on the site. And I think they did put that up there. All right. So Alessi Goodboy asked, is it too much to use allergy and skin, immune support, and Nature's Protection? It seems like a lot of substances at once. Can you please share your knowledge? Okay, so while it may not be too much, one of the things that can happen if you give a lot of different herbs is it's really can sometimes become too much of a good thing, right? You can get some stomach upset, you get some inflammation. So what I always try to do is I always try to pick and choose the priority on what you're trying to treat. Okay, so in this case, if say your animal has allergies and also you don't want to prevent parasites, fleas and ticks, then in that case, I probably would do the allergy and skin and the Nature's Protection and maybe not the immune support. Okay, so you're right. You can stack too many, and then they can obviously they may not be able. If you have too much, it may not work synergistically anymore. So and can cause things like inflammation. So very good question. Very good. Okay, that's most of what we had sent in. Let's start going through our questions today. Oh, we had to scroll down a bit. Thanks everybody for joining. I really, really appreciate it. Hi, Angel. How are you? All right. Let's go. Jennifer. Hi, Dr. Kris. I'm looking for some feedback on my Beagle, Abby. We found out she has a compressed disc in her neck. We have her on pain meds, but she does no steps, but still walks slow, waddle. Just want to know if surgery still can give her a good quality of life. So Jennifer, yeah, surgery is an option for what they call intervertebral disc disease, right? It actually is very common and I do see it in beagles as well, but obviously don't always need it. Okay. One of the questions that I would ask you is, how long have you been doing the pain meds? Are you doing anti-inflammatories or just pain meds? How long have you been doing it? And there's all different indicators on whether an animal that might have a disc problem may need surgery. Okay. And as a veterinarian, whenever you get an animal in that is showing signs of potential disc pain, there's a very important sequence that you go through to evaluate not only what their level of pain is, but you want to evaluate neurologic function. Okay, so there's a whole neurologic exam that we do. Okay, one of the signs, and you probably saw this with Abby, if it is in the neck, is one of the signs that they do when they walk around is they call it the Eeyore Stance. Right? They stretch their neck out and hold their head down so that they take compression. All right. They actually take pressure off those discs. They do it themselves, but they're reluctant to look up. They may be reluctant to go upstairs or jump up. They may yelp intermittently. So I would love to know, Jennifer, how long, what are you using and how long have we been doing it? And are you seeing any difference? Okay. Michael, hi, Dr. Kris. How soon after surgery can I wash mustache? He had his staples taken out a week ago. He's okay. A week down the road, unless he had any complications with his incision, Michael. If it, as far as infection or anything else or ulceration, if it looked good, they took the staples out, then you should be able to wash them now. All right. Hey, Jennifer. Thanks for checking in. Thanks for watching. Oh, Leslie, I answered your question. Thanks. And thanks for resubmitting it. I appreciate it. But we went over yours. Hey, Geraldine. Thanks for checking in. All right, Deborah. Let's see. What if you have used a flea and tick treatment from a vet that lasts for 3 months? Is it okay to start giving them the Earth Animal internal powder also? Or wait until the 3 months is up? No, Deborah, you could start the internal powder. That should be okay, yes. And you're probably talking about the Bravecto, I would assume. And yes, it is something that you can start using it. Did you just give it, or is it a month ago? That would be interesting to know if you could check back in. So Geraldine asked, does bug spray repellent help fleas and ticks? So Geraldine, depending, I don't know if you're talking about the Earth Animal Spray. We've got the natural Earth Animal Spray, which I love, and yes, it does. You got to be careful with spraying certain repellents on and around your animal, okay, that they may lick off. That's always something you have to be very careful about. If they're covered, they can lick, especially some of the heavier duty DEETs and things like that. You have to be very careful, because if they lick it, they can have a reaction to it. So you have to be careful about that. Marianne, I use the Earth Animal Flea shampoo. I was using internal products, but she's on the hypothyroid meds and also on a few supplements. Will the collar be okay to use? Yes, Marianne, the collar should be okay to use. Yes. Yep. Hey, Barry. I hope you're well. Thanks for checking in. Oh, no problem, Millie. I'm glad that I could answer it. All right. Let's see what else. All right, so Jennifer, back to the disc. 1 week pain meds until the MRI will find out. Yes, so they can obviously do advanced imaging to find out the level of compression. Without advanced imaging, we obviously can do X-rays, right? X-rays can sometimes give you you look in the disc spaces, and there's certain things you look for. You look to see if they're smaller, okay, if there's inflammation around those areas. But plain film X-rays or digital X-rays are of limited value as for evaluating specific discs. Really, the advanced imaging, like you're talking about, it does show where the compression is, whether it's one site, multiple sites, and what the level is. Yes. Jennifer, are you seeing any neurologic dysfunction or just pain? Are you seeing any weakness in the front legs, in the back legs, anything like that? All right, Geraldine, what can a pet owner do immediately when their pets begin chewing their feet from an allergy attack, right? So one of the things, Geraldine, that I tell people is this time of year, and it's really become year-round in a lot of pets, but certainly this time of year, tree pollen hits, and it gets, all of a sudden we start to see all that yellow pollen on our cars, right? And you have to imagine that, as we're doing curbside at the vet hospital still, and I'm outside all day doing appointments, and I'm already, I can feel myself. And in the past, I haven't had very heavy seasonal allergies, but I find myself more and more getting it. And so one of the things I was saying is I started taking quercetin, which has helped me. But But I know if my nose is running and I'm sneezing and I have a sinus headache, I know that that's when I'm going to start seeing automatically more and more of our pets coming in and with their feet, chewing their feet. Okay. And the reason why they do is because, yes, they inhale it. They have these are inhalant allergies, but because they're walking around, Geraldine, and they're walking around, it becomes a contact allergy. So one of the things that you should do is, one, this time of year, more hypoallergenic baths so that you can get the pollen off of them and bathe them more frequently. The other thing is wiping their feet every day, every time they come in from a walk with like a sensitive baby wipe, okay? And just getting that off there before it can sit and start to cause that topical allergy, all right? You can use antihistamines with these guys as well, okay? Antihistamines are oftentimes a stopgap. They're not, in most animals, they're not hugely... They're the first go-to oftentimes, aside from things like Allergy and Skin, which is natural, which is a great product. I mean, herbals, okay? But those are a regimen that you want to get on, especially this time of year. But if they're having a real, some animals will reverse sneeze, some animals will really chew their feet. And so an antihistamine like a Benadryl can help die that histamine down acutely, okay? Nothing oftentimes will take it away completely because their histamine levels have just jumped up, and it becomes this vicious cycle where their feet itch, they chew them, they break the skin, they get an opportunistic infection, they chew, so it becomes a vicious cycle. And the best thing we can do is get them on a program that fits them, what their level of itching is. And there's a lot of different options and possibilities, all right? All right, let's see. All right, regarding the Nature's Protection non-yeast, okay, the herbal powder. We're using on our 3 Chihuahuas. One seems to be allergic, possibly. No rash or hives, but she looks around all the time. Stool is normal. Would you think this is an allergic reaction? One of the things that I would check if your dog was licking at their back end, okay, frequently, one of the things to check is their anal glands, okay? Dogs and cats have these vestigial glands on their back end, okay, that are really the same glands as a skunk sprays with, and they're marking glands at some point, but they don't use them. And one of the things that we see a lot, okay, one of the probably least pleasant. Hey, sweetheart. One of the least pleasant. I can't throw that right now, but I will. We're gonna do that in a few minutes. Just give me 1 sec, okay? Go ahead. I'm sorry. So one of the things that we do as veterinarians is we have to go in and check anal glands and empty anal glands of those two organs because they can get full and they can't empty them themselves. So I would check that. Now they can have allergies. Sometimes they get rashes on the tail, but if you're not seeing any sort of rashes, I would bring your dog into the veterinarian and have them check the anal glands and see if they're full. That is a possibility. All right, let's see who's next. All right, Lori. Are the oral meds like Simparica risky too? So Lori, like I said, all those meds carry some risk, okay? And like I also said, do a lot of animals take them and do okay on them? Absolutely, okay? There's a lot of those products out there, and a lot of them do. And you don't know who's going to be sensitive to it or who's going to have an issue with it, as we've seen with them. They all have had animals that have had reactions. But like I said, there are a lot of animals that take them and do fine on them, and they do work for fleas and ticks. But again, our goal as we go forward here, as we are now, and as we go forward at Earth Animal, our goal is to continue to work on simplifying, making the natural products more efficacious, and we're actively working on that all the time, and really now to get that and to integrate this and get this as mainstream as we can. Because like I said, if you can use natural products and they work, why wouldn't you? Oh, hey, Carrie. Oh, okay, cool. So, Pat, I've been using Seresto for 3 years on my 2 Shih Tzus with no problem. Should I be concerned? Should I be concerned? If yes, any recommendations? I think, you know, I think, Pat, it continues to go with what I've been saying, is that, you know, yes, you've been using them and your dogs are tolerating it and doing okay otherwise, and they may be fine using it, okay? Again, it's crystal ball to predict if they're going to have a reaction or not, okay? And so it's hard to say, you know, definitively that, you know, that they won't have a reaction, okay? We certainly know that animals have had reactions. You know, it is, now depending, again, I don't know where, Pat, where you are, if you're in a heavy tick area, heavy flea area. I think, you know, look at the Earth Animal site, take a look at it, read through the products, take a look at that Nature's Protection. And then certainly feel free to get back to me on it with any other questions. I think, again, like we've said, all those products contain, you know, some form of a neurotoxin for the parasites, okay? And there are animals that do not show any side effects to them. Plenty of animals, obviously. There's a lot of animals on these products, okay? But they do carry risks. Okay, Marilyn, let's see. For a small palm, the collar is so big. If I cut it, it will waste most of it. She's on Vetmed and Nalopril. She's also a fussy eater. So it's okay to try the internal, but if that doesn't work, well, I think you can see, you know, I mean, remember, Marilyn, when you cut the collar, you're cutting it to size. So the size, if it fits, then it's okay. Even if you've cut most of it, you've got enough. It fits the size. Okay. But certainly you can try the internals. If she does not like the internals, get back to me at another show and we'll talk about options. Okay. Hey, Mare. Hey, Dr. Kris. I was going to start Jessie on the Simparica, but realized Jessie has had mini tremors in the past. It looks like she's chewing, which has not lasted about a minute. Not sure if that's considered a mini seizure. Don't think she will want the natural stuff. Very picky eater. All right, Mare, we can actually discuss that offline. I think, yeah, I'm always an err on the side of caution person, so I think it's something maybe we'll take offline and talk about. So either we can do it on the phone or email or whatever. You just let me know. But I think it's something we'll spend a little time on and talk about what all of our options are. I am always an err on the side of caution person. I think you know that about me. So we'll talk about options. All right. Good question. Very good question, Mare. Susan, I've used the Earth Animal herbal spray for 2 summers. The best I've tried. I love the herbal spray. I've said it a bunch of times. I love it for if you're walking at night with your dogs. I love it for yourself. I think it's a really good product. I think it smells really good. I think it works. For me, where I live, we get a lot of no-see-ums and mosquitoes, and I found that it works with those as well. So anyway, I thank you very much. I appreciate that, and I really love that product. Candace, how can I tell if I have a spoiled dog? Well, I can tell you right now, Candace, you do have a spoiled dog. Just knowing you and your dog, and there's nothing wrong with that. But I don't think you don't have to guess. I think I can let you know that. But you know what? Why not? And also, an awesome dog. Lori, this is a great question, okay? Is peppermint oil okay for dogs? I thought it was one not to use around dogs, but it is in the Earth Animal collar. Great question. The percentage that we use peppermint oil is safe, absolutely safe at the levels we use, okay? Peppermint oil in high, and essential oils across the board in high dosages can be problematic. Okay, absolutely. But the level at which we use the peppermint oil is safe at the level we use. Okay. All right, Geraldine. Yeah. Okay. Good. So Geraldine, when she had the question about spraying the bug sprays. Yeah, and all good question. I think, no, you know, depending on I use it Geraldine, I use it as exactly what I was saying before. You're going out at dusk on a walk. For me here, and they've got, obviously they're using the whole program. They're on the internals. They have a collar, but you're going to be out and there's going to be a lot of bugs. You're going at night. You may be going to the beach, something like that. I think, so I use it for that. I think, no, I don't necessarily, because it's really settling on top. So I don't think you have to, use a different amount for short or long hair, because it's really going to settle on the outside. Okay. That's a great question, though. But I use it for that kind of thing when you're going to be out in a heavy, kind of buggy environment. And I really, like I said, I really love it for that. Hi, Dr. Kris. Our dog tested positive last year. Andrew, by the way, I think this is a really good question. So, and I have some of my own opinions on this. Our dog tested positive last year for both Lyme and anaplasmosis during his regular checkup. Our vet advised against treatment since our dog was not showing any noticeable symptoms. He still seems fine to this day, but I'm curious if you agree with that approach or if we should seek some form of treatment. Okay, so Andrew, I do have an opinion. I will tell you what I do, and I don't, I want to preface it by saying that there are a lot of veterinarians that if they're not showing signs and they come up positive for these, will not treat them. Okay, when I have a patient that comes up tick-borne illness positive, okay, 3 big ones, Lyme, Ehrlichia, Anaplasma, okay, in my area, all right. We also, our annual test, what we do is we do what's called a SNAP test. SNAP test does heartworm, it does Lyme, it does Anaplasma, and the Ehrlichia, like I said. If they come up positive, we will also do what's called a C6 level on them, which shows what the level of Lyme is. They consider over 30 on that C6 clinical, okay? However, I always want a baseline on that with the Lyme when I first get it, okay? Because I want to know down the road, I want to be able to look at those C6 numbers and make sure they've come down. The first time that I get a positive on a dog, I treat them. One of the reasons for that, is that a lot of the current research and things that we're seeing in clinical practice is that these animals can come up positive. Once they're positive, they think that this can sit in their system for years. Okay, we used to think, if we treated it, it would go away, and if they came up positive, later it was a different occurrence. That's really not the case. They do think that these spirochetes, this Borrelia, this Lyme, can sit in, just almost act like a virus more than a bacteria, okay? And they can sit in the body for a long time and lay dormant. So I do always treat my guys and I've spoken to Dr. Bob about this, and one of the things that Bob and I used to do as an integrative approach, which I loved, is we would use doxycycline, and then I would have Bob do integrative medicine to help with lessen the effects of the antibiotics, as far as secondary effects, and also just help with the animals improving their immune system and treating these bugs. So, but doxycycline is what I use is the treatment of choice for these guys, and I do treat them both Lyme and Anaplasma the first time. Now, down the road, as long as they have no changes to their blood work and their Lyme level comes down, I will not subsequently treat them if they come up positive every year, unless there's an indication the C6 goes up. So it looks like it's a new infection or a flare-up of the old infection, things like that. But I do believe in treating them. And again, that's my belief. It's not everybody's belief, but I think for me, I don't want to leave something sitting there unchecked when I could just at least, when we first see it, knock it down as much as we can. So that's a really, really good question, Andrew. Oh, great, Mel. Well, yeah, let me know how it's going, please. I love the feedback. Oh, Shannon, I'll reach out. I didn't get. You might have texted my old cell phone, but I'll I'll reach out. All right. All right. I'll find out what the scoop is. All right, Beata, how are you? Are the spot-on treatments less harmful than chewables? No, I don't honestly, Beata, I don't think you can say any one is less harmful or more harmful. I think they're all different vehicles, kind of doing the same, very similar things. Okay. So I don't think that you can say, one or the other. I know that your thought process is, well, if the spot-ons are on the outside, they're not going on the inside. And partially true, but certainly some of the spot-ons are meant to go on the inside. You have to remember that anything that kind of gets in through the skin can certainly also go systemically. So I'm not sure that that's true. I think that they're kind of they all have their positive and negatives. That's what it is. Let's see. Britt says, my Karen does great on the Seresto collar. I've tried the natural stuff and it didn't work for us. We live in Connecticut with a lot of ticks. Yeah, look, we are in an endemic area for ticks and tick-borne disease, and I understand that. And like I said, there are a lot of animals that have been on the Seresto collar. There are a lot of animals that have not had any side effects to it, and I understand that, and I understand your point. And Bert, that's why we're getting it, and that's why I'm continuing to talk about it. Really what we want to do is we want to get to the point where we can do as much integrative stuff as we can, and we can try to lessen the amounts of the chemical things and really use the natural things as adjunct in these really seriously, really heavy tick-borne disease and tick areas, okay? Let's see. Oh yeah, Mayor, we'll definitely, you and I we'll talk, okay? Yep, Kirsten, it is our job to spoil them. You're absolutely right. Okay, Shan, ear infection. Did you got medicine? Let me know when you're getting. Let me know. Make sure that it's working, and then reach out, and I'll check those ears for you. Okay? No problem, Candace. Thank you. Yeah, Mel, I don't know that exact answer. I mean, it's a really good question. How long, once the collars are off, does it take all of it to be out of their system? I'm not sure that anybody knows that exact answer. All right. You certainly can call Elanco, I think, or you can call them and see what they think once it's off, when they consider it out of their skin. I'm not quite sure. I will do a little research. I'll see that if I can find out that answer. It's a good question. You're welcome, Beata. Yeah, Stephanie, that's the thing too, right? I mean, you have a dog that literally is in harm's way with ticks at all times, right? So I get it. I understand. And your dog is doing really well, and I completely get that. And I know, I mean, God, he's in the brush and the bushes and everything else. I mean, basically, I don't know what, 40 hours a week. Something like that. So I get it. I understand. You're welcome, Mel. What are your thoughts, Kathleen? What are your thoughts on a FIV positive cats and lesions on their head and face? So, Kathleen, I need some more information on that, right? What sort of lesions are you talking? Scabbing? Are you talking itching? Is the cat itching at the head and neck? I definitely need a little more information on that to talk about it. But you can email me, Kathleen, if you want. If this is something that you have. If you have an FIV positive cat, you have some questions, KRIS, Kris@earthanimal.com. Send me an email. Just give me the scenario, and I can definitely give you an opinion. All right. All right. Oh, we got a few more questions. That's great. Again, thank you everyone for tuning in today. on our remote. Actually, the animals have been really good, so that's been great. Let's see. All right, Lori, with the earth animal collars, do you have to leave them on? Yeah, or can you, or only when they go outside? Lori, leaving them on, putting them on and leaving them on is something that we recommend, similar to any other collars. So it's, I mean, to take them on and off. Also, I just think leaving them on is ideal. Melissa, how common is it to have complications from spay-neuter cat surgeries? Less than 5%. I don't have an exact percentage for you, Melissa. I think that's probably in the range. The complications are, now, obviously you can get surgery inherently, you can get complications with, things can crop up. All animals are individuals and different in how they respond to anesthesia, that sort of thing. But yes, the complications with spay and neuter in cats is definitely very low. Yes. So Vanina, it's another good question, and I think depending on, like we said about Connecticut, I think it all depends. Once again, we're going back to the individual nature of each pet. It depends on what kind of animal, where they go. Are they out a lot? Are they in the woods? Are they out on a deck and then back in? Are they, there's a lot to that. Do they have any underlying issues? Do they have, like we said, do they have epilepsy? Do they have any sicknesses? Are they older? Are they younger? So there's a lot to that question. But again, what I say is you have to look at what their risk level is. You have to look at what kind of animal they are, what breed they are and what they do. I think all those go into the decision. Yeah, that's great, Kathleen. I certainly will help if I can. I will. So yeah, send me pictures would be great. Thanks. You're welcome, Melissa. Thank you. Barrett, my dog is on Interceptor Plus, but I have a friend who doesn't give her dog any dewormer. Is that safe? Well, so Interceptor obviously is a monthly heartworm preventative, right? Interceptor Plus has something else for deworming. Similar, it's a different product, but it does the same thing as HeartGuard. There's certain breeds of dogs with heartworm pills that do better with Interceptor versus HeartGuard. So yeah, and overall, the Interceptor and the HeartGuard, yes, Barrett, has shown a high safety rate. Yes, they have. And again, those are for heartworm, and parasites, not fleas and ticks. Okay. Yeah, Renee, we talked on the show last week, some of the ingredients. Garlic is something that is kind of a hot button topic, right? Certainly when used judiciously, it is effective. You just have to be careful with amounts, things like that. But sometimes it gets a bit of a bad rap, but it can be used. It can be used and it can be used effectively. All right. All right, here's one more thing, guys, and thank you very much. Again, we're coming up on another hour-long show. I think you guys... The questions that you ask are very informed. The shows have been very back and forth, which I love. So please keep tuning in, keep getting those questions, okay? I think one of the things that I wanted to say, just as far as housekeeping goes, is we do have a promo. I think that they did put it up on the screen, and so I'll just kind of reiterate it here. They are offering a free Nature's Protection Flea and Tick Herbal Collar for dogs and cats with the purchase of our Nature's Protection internal powder. Okay, so here's how it works. Okay, you don't need a promotion code for the offer, but you do need to add the collar. Okay, you do need to add the collar on, and then it will be so have the collar in your cart. Along with the powder, and the discount will be automatically applied at checkout. So that's going on till midnight tonight, I believe. I hope I said that right. So it'll be something to check out. And look, guys, I think it really is. If you can try either using the nature's protection as an adjunct to what you're currently doing to potentially lessen the amount that you're doing, or as a standalone in certain instances, I think that it's absolutely worth trying. And you really should know that we are really working hard to continue to develop, continue to tweak these things to make them as efficacious and as safe and efficacious as we can. So stay tuned for things down the road as well. All right. Oh yeah, thank you, Marianne. Thank you, everybody. Listen, I love doing this, and so it's one of the reasons why we keep doing it. This started out last year as just a way to kind of keep in touch during COVID when the world went into the shutdown just a year ago this month, right? And it's something that we've done almost every week since then. I continue to enjoy it. We're going to continue to do these open question shows. We're going to be doing topic shows. We're going to have special guests. We'll be able to, at some point, I'll get Dr. Bob and Susan on here with me, I promise. Listen, it's really become a great vehicle for us to just talk about the products and anything that I can do to help you guys with what you're going through at home. So thank you very much. Spring's coming, spring this weekend, right? Officially. So the good weather's ahead. Hope everyone stays safe. Have a great weekend. And thanks for joining me from my kitchen today. I really appreciate it. All right. Bye, guys.